transition from summer to school, whether in person or virtual, we thought now would be an opportune time to focus on our children's health and safety. Our Let's Talk community conversations are designed to increase awareness about important health issues, provide key health information to our community in a clear, useful manner, improve patient and physician discussions or discussions with any other healthcare provider, and help patients and families gain tools that can help maintain or improve their health. We have two outstanding physicians here today to speak with us and to answer questions about children's health and safety. Our first speaker is Dr. Anna Banju. Dr. Anna Banju is the Medical Director of Pediatrics and an outpatient pediatrician at the University of Maryland Medical Center Midtown campus. She attended medical school at George Washington University and completed her residency at Columbia University. Dr. Ajayi Akintadi, or Dr. A as she's sometimes known, is a tireless advocate for children. She's a neurodevelopmental pediatrician and the assistant medical director at the University of Maryland and Johns Hopkins Mount Washington Pediatric Hospital in Baltimore. Dr. A completed her master's degree in occupational health at Harvard, her pediatric residency at Howard University, and a fellowship in neurodevelopmental pediatrics at Johns Hopkins. Ladies and gentlemen, as the conversation proceeds today, please feel free to use the Q&A box, the Q&A feature on your screen to type in any questions you may have. Our presenters are happy to answer as many questions as time will allow, and should we run out of time, we'll be happy to post the answers to those questions at a later date. We'll come back to that at the end. Also, the presentations that you see before you today will be available after today's conversation, and I'll give you more detail on that as well. And so with that introduction, Dr. Anabanju, would you get us started, please?
So a way to take charge of your health is to use the Ask Me 3 program. The Ask Me 3 program is a way to really ask your doctors, physicians, nurses, and healthcare providers about your health. There's 3 simple, straightforward questions that it's important to ask. What is my main problem? What do I need to do? And why is it important to do this? Today, we are going to focus on wellness and prevention in the pediatric population. Wellness is very important. It is a way to take a proactive approach to maintaining a healthy and balanced lifestyle for yourself as well as your children. It makes up the bulk of what we do as pediatricians, and a few areas that we want to highlight today include the following: well visits, immunizations, nutrition, sleep, lead poisoning, physical safety, safe outdoor play, social emotional safety, bullying, and staying socially connected while socially distanced. So to start off with, we want to focus on well child checks or well child visits, or also known as health supervision visits. They're visits dedicated to focusing on preventive care for kids. Many families view well visits as not important and often will miss their appointment. So we do want to talk about why is it important. So well visits are important because it's an opportunity to focus on prevention and providing immunizations. Preventions can range from vision screening, hearing screen, lead screen. It can also be an opportunity to track your child's growth over time to make sure they're growing well and to focus on their development and making sure they're meeting their milestones. I always say to families, it's really important that we address your concerns. So if a well visit is an opportunity to focus on problems or concerns that you may have, I always say it's important to make your list, create that list, and determine which of those topics you want to talk about with your doctor for the day. We all know that when kids attend their well visits, and it's a team approach amongst parents as well as the patient, kids' outcomes and kids overall do better. We do recommend that you schedule your child's well visits based on the schedule that's put out by the American Academy of Pediatrics. In the first year of life, kids will get a lot of visits. It usually starts 3 to 5 days after birth, and then at 1 month, at 2, 4, 6 months, and 3 months thereafter until they're about 18 months, and then we space out a little bit further until they get to a point where they're seeing us less frequently and more annually. The next topic we want to talk about today is immunizations or vaccines. What the ongoing pandemic has taught us is that our rates of vaccines are continuing to decline, and there are many reasons for why our vaccine rates in the United States are declining. The thoughts are that families are nervous and scared to go see their doctors, and that kids are not getting vaccinated. We know that, or we worry that as our immunization rates continue to decline, it will put our population at risk, so children and their families may be at risk for vaccine-preventable diseases. It's really important to know that all children are at risk of getting a vaccine-preventable disease, even those who are healthy. Vaccines are safe. We really do recommend you schedule your child's appointment today, especially if they're behind on their vaccines. It is safe to bring your child to the doctor's office. A lot of offices are taking the measures needed to keep both families and patients safe. So we wanted to use the Ask Me 3 technique with the case. So the question is, my child woke up with a rash and a fever this morning. The next question to ask is, what's the problem? And your child may have measles, for instance, especially in the setting of them being unvaccinated. Measles usually presents with a rash, a flu-like symptom. There isn't a specific treatment for it, so what do you really need to do? If your child is sick with measles, for instance, they should drink plenty of liquids, get a lot of rest, stay home from school or daycare to prevent the spread of infection. We know that measles is very contagious in the setting of others being unvaccinated for measles. The likelihood of becoming infected with the disease is really high. We do monitor kids with measles really closely to make sure they don't develop complications, so you always want to stay in touch with your doctor if your child has measles. So why is it important? Once again, it's highly contagious, and it can lead to severe conditions and should be monitored closely. The next topic we wanted to talk about is nutrition. So many children and families have busy lives, which makes it hard to sit down and have a healthy meal. Many kids' diet include unhealthy foods such as junk food, fast foods, things that are easy to and processed foods. Unfortunately, unhealthy eating can continue until adulthood and can lead to lifelong diseases such as hypertension, diabetes, heart disease. So why is it important? It's important because changes made now, especially in your child's life earlier on, can help decrease the lifelong effects of hypertension, diabetes, and obesity. So making a change now can be something that's lifelong and lead to healthier habits in adulthood. Parents always ask me, how do you do that? So you want to learn and for yourself to teach and support your child on how to have a healthy diet. It's important to start early and be a good role model. You want to monitor your child's eating habits, especially for your teenagers, not having unlimited access to fast foods and junk foods. You want to modify recipes. So if a recipe calls for a full stick of butter, you can either decrease that portion appropriately to get the effect that you want in your baked good, for instance. We do recommend decreasing or avoiding sugary drinks completely. So even your juices that are 100% fruit juice still contain sugar. So it's really important to know that not all drinks are healthy. The healthiest drink out there is water. We recommend that kids eat more fruits and veggies and limit screen time. limited screen time allows your child to be more active and playing outdoors and doing other things that will keep them healthy. Our next topic is sleep. Poor sleep is common, and it's a problem that many parents face with their kids. Studies have shown, though, that when your child gets the proper amount of sleep, it improves their attention, their behavior, their ability to learn, and their overall mental and physical well-being. It is important to teach your child good sleeping habits. A few things to consider doing is making bedtime special. So having a simple and regular routine, such as reading their book, changing into their pajamas, brushing their teeth, and then laying in bed. We don't recommend that your child has a bottle in bed to soothe themselves to sleep, especially in the younger ages. It does put them at risk for cavities. And then we recommend not having too many toys in your child's bed because sometimes that can be more exciting to play with your dolls than going to bed. The other thing I always recommend is to limit screen time before bed, and if possible, to have no television, video games, or activities like that in the bedroom. And if you have to, making sure everything is turned off when it's bedtime.
Thank you, Tolu.
No
problem. Like Donna said, making sure that our children are safe and healthy is what today's talk is about. Not only their physical health, but their emotional and social well-being. And especially in this new normal of COVID-19, it is ever more important that we find ways to help each child achieve his or her own maximum developmental potential. Talking about lead, lead is a useful metal and has been in existence for over 3,000 years. In fact, the ancient Romans added lead to their wine to make it sweeter. Unfortunately, there is no safe lead level. Because of the high hand-to-mouth activities children do, they are at the greatest risk for lead poisoning. With COVID-19 and the restrictions in place, more families of children are staying indoors, which can lead to higher exposure to lead poisoning. So what can we do? Like you already heard, it is most important that children see their doctors, see the pediatricians, keep those well-child visits. Starting at age 1, children should get their lead level tested. The importance of eating right and eating better cannot be stressed. We all need less fatty foods. We need foods that are rich in vegetables, iron, and calcium. For those of us who live in older homes, especially those built before 1950, we should request a lead inspection of our homes. And if lead is found, there are ways to clean the lead and get the lead out. Why is lead poisoning important? I think foremost because it is a very easily preventable form of poisoning. It's also important because, unfortunately, it affects children. We know in the first 3 years of life, the brain development is at its highest. So it's important that we promote that development and avoid any poisoning that can limit or halt that development. So using the Ask Me 3 questions, a parent comes in saying the 6-year-old child has been tired, not much of an appetite. They just moved into an older home and found paint peeling on the walls in the basement. What the problem is, make sure you get that blood level tested, which was done in this instance, and it was high. What can we do? Well, the source of lead has to be removed from the home. There are special ways to get lead out of a home. Why is it important to do this? Again, because lead is toxic and affects all aspects of a child's development. Not only the brain growth, even the physical growth is also stunted with lead poisoning. Physical safety and physical well-being is more of a challenge in this new norm of COVID-19. But we also know that remaining physically active is good for the child and for us all. Especially in children, it develops the motor skills, it builds strong bones and muscles, and overall they feel better about themselves. How do we play outdoor safely in a pandemic, knowing that all lives have been upside down, especially for children? They're not allowed to go to school, they're not allowed to hang out with their friends, and all this we know has resulted in increased anxiety. First and foremost, we need to teach our children to stay safe. So things like washing hands with soap and water as often as possible, keeping the social distance, and wearing masks when able. As a family, we should participate in low-risk activities like jogging, like running, like walking. And if we have to be in gatherings that are large, we should keep that social distance. Playground is a useful place, a good place for children to run around and get physically active. When we have to go there, let's go at times when there are not too many people, if we can. Safe outdoor play, physical activity promotes executive functioning of brain development in children. And those skills that teach children how to cooperate, to play with one another, to take turns, to negotiate, to multitask. So it is really important. We also know that staying physically active promotes overall well-being. And we know that a healthy, active child will likely grow into a healthy, active adult. Social and emotional safety is also something we should pay attention to in this new norm of COVID-19. We know that children are worried, are concerned about all these new rules as parents that we are handling down. It is important that we present information to our children in a manner they will understand. We know because of this anxiety, there has been disruptions in their sleeping patterns, the way they eat, lots of complaints of headaches and stomach aches, and all this is because they're worried. As parents and adults and caretakers, what we need to do is find a way to reestablish routines. Even when children are not getting ready to go to school, we should still have basic routines. They go to bed at a certain time, they get up in the morning, brush their teeth, wash themselves, and begin the day. We should encourage conversation. And that's important because if we don't talk to our children about what is going on, they will get the information, mostly not right, elsewhere. In having those conversations with our children, it has to be done in a way that they understand. It is very important, too, to be good role models. If we are asking our children to keep a social distance, to wash hands with soap and water often, and we are not doing that, it is very unlikely they will do. It's important to acknowledge, to let children know that it is okay for them to be worried, but also the adults to ensure them that if these things we've taught them to do are done, they will remain safe and healthy. Why is it important? We are social animals, human beings. It is through socialization we get to work together. For children, it's a big deal. They learn to take turns, they learn to share, they learn to cooperate, and above all, they make friends. So children need to feel safe not only now, but also about their future. Children with healthy minds grow into adults with healthy minds. Bullying is something we don't talk enough about, but we should. We know at any time in the United States, at least 95% of our teenagers are online. However, only 10% of children ever inform parents or adults that they're bullied. There are all types of bullying, but with COVID-19 and most indoor staying, cyberbullying is on the rise. As parents, we need to be aware that this is a risk. We need to empower children to talk, to report, to speak up. It's also important to socially connect with their children, know what sites they're visiting. And above all, we should discourage our children from sharing personal information that can be a source of harm in the future. The internet has been called the faceless evil, and that's a term I truly believe. We know that bullying is wrong and affects all aspects of a child's development. What's even important to know is that those negative developmental effects is not only for the children who have been bullied, but the children who bully others. Bullying can result in all things like this, like depression, low self-esteem, problems sleeping, problems eating. And in some studies done in the United Kingdom, there actually has been an increased rate in suicide related to cyberbullying. And some studies have also shown that children who are bullied are at risk of substance abuse in later life. So go back again to the Ask Me 3. This parent tells you that the 8-year-old daughter has been spending a lot of time in her bedroom lately and not interacting with the rest of the family. What is the problem? The mother wants to know. And there are many things that could be going on with this 8-year-old. Certainly with COVID-19 restrictions, she might be feeling lonely because she's not allowed to play with her friends, because her routines have been disrupted. This also may be bullying. So what do we need to do? We need to sit down with this child, have a conversation with her, keeping those conversations to a level that she understands. It's important to know how she's feeling and to let her know too, even if you don't have all the answers, assure your child that you're there to support her. If virtual visits can be rearranged with friends, we should do that. If there are safe social activities your child can participate with, things like running, walking, or jogging, do that. Why is it important? Well, because we know that behavioral problems can become a big issue later on in life. And as I said earlier, it is not only keeping our children physically well, but mentally and socially as well. How do we socially connect while socially distancing? Especially things like I said before, human beings are social animals, and our brains are wired to connect. And we know social interaction is actually good for emotional development. We again should provide age and developmentally appropriate reasons for social distancing. And while we're doing this, it's important that we ourselves are good role models. We need to teach our children to avoid contact with others, wash their hands often with soap and water when able, wear masks, and avoid handshaking and hugging. Arrange virtual playdates when possible. Social distancing is the best way to slow the spread of COVID-19 so that we as a community, as a world actually, can go back to a normal way of life. We know that social interaction is related and promotes emotional development. And we know that emotional development and physical growth are related to each other. We need to keep our children engaged with their friends. We want to avoid them being lonely. We know that the overall well-being and quality of life is improved when that social connection stays in place. Above all, we want to make sure that children feel happy, loved, and remain healthy. These are some good resources to check out. The CDC, Center for Disease Control, Safe Kids is a good one, healthychildren.org, there's the American Academy of Pediatrics, and of course, Medline Plus.
Dr. Anibanju and Dr. Akintadi, thank you so much for those comments. They were so useful and so very informative. We appreciate it. When we shift right now to the questions and answers that have come in, questions that have come in already, answers to follow, I want to remind everyone listening that if you would like to pose a question, do so by typing it in the Q&A box. And again, we will try to get to as many questions as the time will allow. One of the first questions that came in to be anticipated here is it safe for my child to go to school at all during this pandemic? Similarly, is it safe to participate in athletic activities? Who would like to tackle that one?
I can take a go at the athletic participation. Actually, let's talk about the school. Is it safe for a child to go back to school? I think the answer is yes and no. What we do know, and what the last slide said, was that to slow down COVID-19, we need to keep a social distance. I know some states have reopened schools. I also know there's no one answer that fits every situation. Some school systems have decided to have virtual schools for a few days of the week and in person for the other days. And I know those schools have tried as much as possible to keep the children's desks apart, to screen the children before they come into school, and to teach the children, too, to practice all the things we need them to do, like washing hands and wearing their masks. So I think it is possible, if those things are put in place, to allow children to go back, maybe not every day, but on some days, to school.
Thank you for that. Dr. Anibanju, did you want to add to that answer?
I agree. I think the biggest thing I would say is knowing the incidence of COVID in your community, and every community is different. So returning to school may be not as risky in certain environments versus in other environments, it may not be the safest thing to do. I think regardless, whether it's virtual learning, I think it's creating a learning environment that works well for your child, whether it's virtual or in person. If it's in person, making sure all the things that we mentioned are in place, wearing a mask, social distance, making sure we're screening for those who are ill and keeping them home. But I think there's not going to be a perfect answer until COVID has gone away. But I think keeping your child engaged and healthy and still learning is going to be the biggest goal. And for kids with special needs, is making sure they're getting their services that they need to continue to develop appropriately.
Well, we thank you for that advice. We know certainly that this is a topic that is on everyone's mind about now, certainly every parent's mind. Another question here is, how should someone go about finding a pediatrician?
Mm-hmm. So a good start is you can ask friends and family, who their pediatrician is, or you can reach out to your insurance company to figure out which pediatricians are in your network. A lot of pediatric centers actually have online websites that you can also browse through and learn about their resources. And for parents with young children or newborns, you can also do meet and greets, so you can meet the pediatrician and to get to know the practice as well as their style.
That's great. Thank you. Next
Can I also
question.
add something to that?
Yes, sure, please.
That in the northeast part of the country, we are really blessed that we have excellent and several good hospitals for children. So like Tolu said, talk to your friends, talk to your neighbors, but check those individual hospitals out and see the pediatricians that are listed and get to know them.
Good, very good. Thank you. What are the 3 most important things a parent should look for in a child's developmental process?
I'll take a Go ahead, Tolu, if you want to talk.
No, it's for you.
Okay.
We'll hear from both of you.
So when you look at child's development, the easier way to look at it is, what can my child do with hands and feet? And can my child talk? So 2 big things, motor skills and language skills. If you talk about which of those 2 will be more important, I would say language skills. So there's our ability to communicate, our ability to talk to each other, that sets us apart as human beings. But that said, those 2 streams of development should be looked at. And when you talk about motor skills, we know that by age 6 months, most children are sitting independently. By age 1, they should be walking by themselves. In terms of language, we know that babies come out and they're cooing and they're babbling by age 5 months. But we expect a child of about age 1 to have at least 1 or 2 words. So I would pay attention to the language skills of your child, and also what is your child able to do.
Great, Dr. Anabanju?
I echo same comments, communication, gross motor, and thinking about those areas and how are they interacting with others. I think we'll kind of cover those 3 most important areas of development.
Great, thank you. My health plan offers telemedicine visits. Are those a good option for my child's well-being and care?
It depends. So well visits are structured in a way where you're seeing the doctor and you're getting evaluations for lead, for instance, a hearing and vision screen. And some of those services you're not able to do it via telemedicine. So there are certain visits where you can consider doing a telehealth visit where you don't have to do a vision screen, immunizations, and all the other preventive measures. But I do think that in-person visits are ideal. And if you end up doing a telemedicine visit because it's offered by your physician or your plan, it usually will require a follow-up at a later date for your doctor to measure your child's growth, to give them their vaccines if needed, and to do all the other screenings I mentioned, such as their hearing and vision and their lead and CBC, for instance, which screens for anemia.
Great. We have time for 2 or 3 more questions. So I hesitate to ask this one because I was an utter fail in this regard. My children are old now and they survived, but what's the best, most effective way to take my toddler's temperature?
So it's a hard one when kids don't feel well. I think a lot of parents will use the mommy hand, right, and measure based on like whether they feel warm. But I think having an actual measurement is really helpful. So you can take it orally, where you put a thermometer in their mouth, but sometimes they don't really like that. I like it under the arm where they're wearing a T-shirt and you're giving them a big hug and you put the thermometer underneath their arm, and while you're giving them a hug, you're also measuring their temperatures. There are other devices that are out there, such as a forehead thermometer or a thermometer in the ear. So there are other techniques that could work. Is just figuring out what works best for you and your family. Some methods are better than others, but a fever is still a fever. So if you have a temperature in any of those ways of measuring, it's still important to document that.
Related question, you just said a fever is still a fever. How do I know when medical intervention is needed when my child has a fever?
Mm-hmm. So it depends on why they're ill. So if they have a fever and they're playful, they're well-appearing, or they're eating and peeing well, they're more than likely going to be okay. I think if you have any questions or you're not sure if they're doing well, there's always a way to reach out to your pediatrician to discuss the symptoms to help guide whether to be worried or continue to manage it at home. I do think in the setting of COVID, everyone's worried about a fever, so it would be nice to kind of reach out to your pediatrician to talk through the symptoms that they're having to help guide what to do next.
And I think that's important to know too, that as people, as human beings, we get all worried about numbers. We should remember, though, for children, a number is not the sum of that child. So if you really know that your child has a fever, but like Tolu said, your child is eating well, he's playing well, there isn't anything else, just keep an eye on the child until you give the child enough to drink. It's also important to stay in touch with your pediatrician. When do you become worried? If there are changes and your child is no longer acting himself or herself, or when you repeat that temperature, the temperature has gone up, that would be a good time to get on the phone and ask for your child to be seen. It ties us back to having healthy children, healthy, active children. A fever itself is not a bad thing. So you have to take it in the context of the other changes you've seen in your child.
Helpful, very helpful. Another question here is, why does my son need the HPV vaccine?
So the HPV vaccine, we start giving the vaccine early, actually. We can give it anywhere as early as 9. Most people will start at their vaccine at 11. The HPV vaccine is for both boys and girls. HPV vaccine is actually one of the only vaccines that actually prevents cancer. And I always say to families, how great would it be to help decrease their risk of developing cancers in the future? So we all know that girls can develop cervical cancer in the setting of HPV infection, and actually boys can develop cancers as well. It can be localized to like the mouth region, so oral cancers or throat cancers. HPV has been known to be one of the common cause. So we do really promote giving the HPV vaccine for both boys and girls to decrease their risk of developing cancers, anogenital warts, and other types of infections.
All right, got a few questions coming in here now, traditional ones. How do you help younger children less than 2 years of age to interact with other children while socially distancing? And are virtual play dates appropriate for them?
Yes, virtual play dates are appropriate. But for a 2-year-old, unfortunately, the parent also has to be involved in that play group. So you just can't expect the 2-year-old to play date with another 2-year-old on his or own. But if you reach out to the parent of the other child you want to have a play date with, then you should be able to, with your child by your side and the other child by that parent's side, be able to do something together. Simple things. It might be taking a ball of a different color having the children, talk about the different shapes or the different colors. But yes, it is doable, but there's no doubt that the parents also have to be active participants for this to work.
So there are several other questions related to this current pandemic era that we're in. And one is, with both parents working from home, it's challenging for us. How long is too long to keep a 7-year-old playing or functioning on their own?
Playing on their own, I'm not quite sure. Are we saying this is a 7-year-old who is all alone, has no siblings, and the parents are home, but they're busy working? Is that what this question is?
I would think that that's the question, yes. The parents are both working and they have one child.
I should first go back. Since in normal times, there's no 7-year-old that plays all the time, 24/7. We go back to the importance of establishing routines, even in this COVID time. So I would expect a 7-year-old to wake up in the morning and have a shower, eat breakfast, go to school, even if school is online or virtual. And at the end of the school day, wind down with activities, either through virtual playdates with his friends. Like Tolu already said, I discourage children having television screens or television sets in their rooms. We certainly can encourage these children to read books. If the parents can find time during their workday to spend 20, 30 minutes with their children, that would be something they can do. The parents hopefully also have a few minutes a day where they can walk around the neighborhood, stay active together. So a 7-year-old shouldn't be allowed all day to entertain himself or herself. We really need to establish those routines.
Great. Here's a question from a parent that says, I'm sorry, Dr. Anabanji, did you have a comment?
Yeah, I just want to add, I think it is very difficult to be working from home. I mean, as parents having back-to-back virtual meetings, at least what you can do is, in a weird way, create an agenda for your child too. So whether it's, while I'm on this virtual meeting for my job, this is going to be your coloring time or your time to do a puzzle beside me. So creating activities that even if they're right next to you and they're doing it alone, there's an opportunity for interaction with their parents.
I have a question here that says, my child is in a school system that's announced that they'll be virtual until the end of January. Any ideas on how we encourage the school system to do something that's more interactive?
So you can be a part of your school, like every school has like a parent group. I think virtual learning is new for parents as well as teachers and schools. So every school is going to offer an opportunity for feedback to kind of talk about what's working and what's not working and what parents are having challenges with. So I think it's going to be really important to have that open dialogue, and if you're finding that it's not very interactive, they need to know that in order to figure out a way to modify it so your child can learn in the best possible manner.
I think it's important. These are really strange times we find ourselves, and there's really no right or wrong answer. It is important, though, like Tolu said, to have that line of communication open with the school. Teachers I know, my parents were teachers too, really love what they do. They want their kids back to the school. They want the norm. But at the same time, they want to make sure those children and themselves too remain healthy. So I cannot fault any school systems that says until next year we're all going to be virtual, or another school system that says it's going to be half and half. whichever way you decide to do, keep that line of communication open. Know that we are all in this together. And our aim is to remain healthy, make sure our children continue to thrive, and solve these problems as they arise.
Great. I know that you both have patients to see shortly, so I just have two very short questions, I think, here, and then we'll conclude. My 4-year-old son clears his throat often in the morning, and I'm not sure if it's a habit or if it's something that needs medical attention. Should I be worried?
I told you I can do this, but let me just say something. I really wouldn't. It might be a habit. I'm hoping that 4-year-old has seen a dentist and the teeth have been checked out. But if it's just clearing the throat in the morning, no fever, no rash, otherwise doing things normally, why it's irritating to the parent. If a child is fine, why should we worry about that?
Very good. And then one last one. Oh, I'm sorry, Dr. Anabanju, did you have a comment?
Very similar. I think it just depends on what other symptoms that they're having. If they have allergies, if they have, postnasal drip, it could very well just be a habit, and it could very well be nothing. I think it's just talking through the symptoms with your doctor to kind of help navigate which of those symptoms to kind of go with.
Okay. And our final question on the minds of many is it too early to get a flu shot for the upcoming flu season?
Mm-hmm. So we are coming upon flu season soon. So every practice will receive their shipment of flu shots depending on when the shipment is made. Some do it as early as end of August to September or October. So I do think it's coming soon. Our practice, we haven't quite started yet, but I think you should just touch base with your pediatric practice to see if they've received their shipment of flu shots yet. But as soon as it's available.
Go
ahead.
I just want to second what Tony said. We should all get influenza vaccination. It is important.
Agree 100%. Doctors, I want to thank you both so much for such an informative discussion. I know that those listening have gotten quite a bit out of this. I want to let all of our listeners know that a recording of this webinar will be available to you in 48 hours. We have all of the webinars in this series available to you at www.ums.org/Let's Talk. So those that have gone in the past are available, and again, in 48 hours, you'll be able to find this. I hope that you all will take an opportunity to join us each month. We have a webinar/community conversation the third Wednesday of every month at noon. Next month, we'll be talking about men's health, and we've selected the noon hour so that people can join us even at their lunchtime, should they like. Again, thank you, Dr. Anabanjo, and thank you, Dr. Akintadi, for your presentations today. Very much appreciated. We're grateful, and we are done. Thank you all for joining us today.
Thank you.